I acknowledge the land I'm standing on is a traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. Today is such a heartwarming day. It's such an amazing opportunity to remember folks who we've lost to overdose. In celebration of the International Overdose Awareness Day, City of Toronto, along with many of our partners, came together and we're having a full day out here on George Street. And I just can't express how important this is. This is such a terrible, terrible, terrible tragedy that happens to folks. And so our hope is that by getting the message out and spreading the word, that we can remember those that we've lost and support those that, so that they're able to safely use. Thank you.
I'm an overdose prevention support worker at Parkdale Queen West Community Health Center. I work at the Parkdale site, which is at Queen and Dufferin. So here today for International Overdose Awareness Day, just trying to raise awareness about the glut of overdose deaths that have occurred in the last 10 or 15 years among people who use drugs. We offer, I work at the Safe Consumption site, which is a place where people can come to use drugs safely and in a supervised manner. They can get referrals to other kind of healthcare. They can get information about harm reduction. They can have their drugs tested at our location too, find out exactly what's in the drugs people are using. And we also offer a safer opioid supply program. So that's for folks who get referred to the program who may have an ongoing opiate issue. Because the street drug supply is so dangerous and so toxic right now, we want to make sure that people are able to recuperate and rehabilitate at their own rate. So we try to offer them something analogous to the drugs that are beyond the street, but in a context where it's pharmaceutical and safely supplied. And yeah, it's great to have everyone here today. It's like great to see all the sites, but ultimately it is a kind of sad occasion. We're marking the deaths of people who passed way too soon for reasons that could easily have been avoided. So, I'm glad we're all here, but it also sucks that we're all here too.
It's International Overdose Awareness Day. I'm Kristen Wong-Tam, Member of Provincial Parliament for Toronto Centre, and I'm here right on George Street, right in front of Seaton House, Canada's largest men's shelter. This day is critically important because we've seen many community members lose their lives due to a poison drug supply. And we know that drug use should not be a death sentence. People have been using drugs since the beginning of time. It's important for us to raise the awareness and to break through the stigma and also to build understanding, because these are people who are family members, and at some point in time, if you haven't already been affected by the overdose crisis, you will be. It's only a matter of time. The things that we're looking for here is to, number one, make sure that the community knows that they are supported. So there's a number of community tents that are here from organizations, large and small, that support the community of drug users. The other thing we're seeing is that the City of Toronto has really stepped up to provide some support, and they're here represented as well. But we don't see anyone from the province besides myself, and that is clearly wrong. Mental health and addictions sit squarely under the purview of the provincial government, so it's time that that government steps up. Things that I've asked this government for include the decriminalization of drugs, so we can actually treat this for what it is, which is a health crisis. We also need to make sure that there's rapid and free testing of drugs, so therefore we can guarantee a safe supply. And finally, is that when people are looking for crisis beds so they can get on to a path of recovery, we would be able to do that as well. So treatment beds are absolutely needed. The overdose crisis is affecting every community across Canada, large and small, and our community in Regent Park is not immune. So to all those in Regent Park, I want to tell you that I stand in solidarity of you for those mothers and fathers who've lost their children, siblings who've lost their brothers and sisters. I'm thinking about you on this day. Together we will overcome this crisis. Together we can get it done.
Hi, so my name is Sarah. I work with the Ontario Aboriginal HIV/AIDS Strategy, OHAS, and we spread and share education and awareness around HIV prevention, treatment. We provide support services to IPHAs, which would be Indigenous people with HIV or AIDS. We provide support services to them. We also provide harm reduction services to the communities. We have a peer outreach program, and so the peers go out and they provide harm reduction supplies to community members. We have a regular outreach route that they do. So we're here today at the International Overdose Awareness event, networking with other agencies within the city, sharing what we do with other agencies, providing some harm reduction supplies, naloxone. We provide naloxone training to our peers. Naloxone training is very, very important in the prevention of overdose. So we do share that. We share education around that. And yeah, that's pretty much what we do at OHAS. So we are located at 282 Parliament Street. That is the corner of Parliament and Dundas Street. We're not only located in Toronto, we're also located in Sudbury, Sault Ste. Marie, Thunder Bay, Barrie. So we also, we provide our harm reduction services from an Indigenous harm reduction model, which means that we don't turn away. Some teachings would say that we don't touch the medicines when we're either using or we've been drinking, but from our model, we provide those services, and we welcome people to come and use at any point in their lives. We don't judge them. We meet them where they're at, and yeah, we give them those services regardless of what state they're in. We believe that that's when their spirit needs it the most, so we welcome that. So big lids, thank you.
Hello, my name is Letitia Francis, and my organization is Seaton Health. I'm one of the Seaton Health nurses here, and the thing that we're dealing with is vein care. What we have here, what we're giving out is the Sharpshooters. It's a book that educates people who are users and those who are non-users and wanting to learn more information about drug use. And it's all tying in with the Overdose Awareness campaign that we're running here. So basically with this vein care, it's teaching you about the different kinds of things that you can use, the kind of infections that you can get in your veins from using needles, and the kind of equipment that we have here shown, what kind of equipment you can use for people who are using intravenously. And it shows you how the areas that are safer for you to use and the ones that are not so safe for you to use, based on how you can get different kinds of infections and which are safer from getting infections.
So my name is Michael Birch. I am the HIV and Harm Reduction Program Co-Manager over at Maggie's Toronto. Maggie's Toronto's offices are located at 526 Richmond Street East. We are one of the oldest by and for sex worker advocacy and support organizations in Canada. In my role at that organization, I'm involved in providing harm reduction services. And so it's in that role that I'm partially here today. So Maggie's provides a myriad of services, including drop-ins, food programs, workshops, advocacy, Yeah, lots of different functions. If you want to learn more about our programming, you can visit www.maggiesto.org. Lots of information on our website. Today I'm here handing out crack kits, long injection kits, naloxone. We've got safer snorting kits. And then I'm also handing out risk reduction supplies. So I'm handing out things like condoms and lube and dental dams, and just giving out lots of general information to folks about safer sex and harm reduction, including encouraging folks to get their monkeypox vaccine.
Hi everyone, it's Sammy from Friends of Ruby. I use she, her pronouns, and at Friends of Ruby we are dedicated to serve the 2S LGBTQIA+ community, and we envision a world where all 2S LGBTQIA+ youth are empowered, validated, and involved to lead healthier lives. So at Friends of Ruby we currently have two facilities. One is a drop-in center and one is a transitional house. So our drop-in center has programs such as grocery days, BIPOC Wednesdays, Doer Mondays, and as well as free case management and free counseling. And at the transitional house, we support youth in their journeys to independence through housing, and we support 33 youth currently, and it's been an amazing journey to support the community. So today is the International Overdose Awareness Day, and we are here today to commemorate those that we have lost through overdose, and we are here to bring awareness to that. We also, at Friends of Ruby, we offer harm reduction kits. So if you drop by our location, our drop-in center at 489 Queen Street East, you're able to pick up your harm reduction kits there.
Hi, I'm Theo. I'm SSA on the 4th floor here at Seaton House. I support the counselors, and we're here today making buttons. We got Seaton House Shops program buttons, and I carry naloxone and other buttons, and we're just making sure to get people some swag here today. And you know, we're thinking about all the people we've lost, especially over the last 2 years, to the opiate crisis, the drug poisoning crisis, and here we are, and hopefully changing minds and hearts about overdoses.
Hi there, my name is Katrina Delano. I'm a registered acupuncturist and Chinese medicine practitioner. And we are here today offering free NADA acupuncture treatments. This is an auricular, so an ear acupuncture protocol of 5 different points that was developed by the Young Lords and the Black Panthers in the South Bronx in New York in the 1970s in response to the heroin epidemic that was happening. So it was a grassroots community health initiative that they developed to support all of the folks in their community that were dealing with addiction. Addiction is a disease that results from the trauma that people experience in response to systems of oppression, marginalization, discrimination. Black, Indigenous people of color and the poor suffer from addiction far more than other groups. And so what we're doing here is we're helping to educate the public about the power of Chinese medicine and acupuncture, because it's a very effective treatment to help those who are detoxing, folks who are drug users experiencing addiction, and those who are trying to come off of those drugs and find sobriety. So it's a very, very effective medicine, and we're here to share that on International Overdose Awareness Day.
I just wanted to take a couple minutes to thank some people for today's event. There are so many people to thank. A lot of hard work went into planning the event, so some giant thank yous are in order. First, I wanted to thank Joe. I don't know where you are, Joe, but this started off as a casual conversation between Joe and I, like, hey, let's do something on George Street, and here we are. I wanted to thank the Seaton House management team, the dietary team who are feeding us today, the property services team that are making sure George Street looks nice, all of the frontline staff here, the shop staff, SSHA head office and Stratcom. I wanted to thank Street Health, I think they might be down that way, for being one of the first partners at the table. And we've got 15, 20 partner agencies and programs that are here saying that we need to bring attention to Overdose Awareness Day. So on that note, I'd like to read an overdose acknowledgement. We want to take a moment to acknowledge the tragic and substantial losses that people continue to face due to the ongoing drug poisoning crisis. These losses and the grief experienced are immeasurable. We acknowledge that this crisis is rooted in systemic discrimination. People who use drugs often experience stigma and multiple intersecting forms of discrimination, including racism, sexism, and colonialism. We commit to collective action to address the drug poisoning crisis. Many of us are in mourning, individually and collectively. We grieve for our loved ones, friends, families, chosen families, colleagues, clients, and communities. Today is International Overdose Awareness Day, a day that shouldn't be. So many lives lost and hearts broken due to the things that are preventable in our communities, governments, lawmakers, funders, and healthcare systems to make drug users' rights, safety, and lives a priority. And I want to tell you all that on August 22nd was the 9-year anniversary that I lost the love of my life, my best friend, and my child father to an accidental overdose. And I carry that with me every day in every decision I make and every breath that I take. And that stigma was a big part of why that happened. So I know that a lot of you are in pain with me on this day, and I'm here in solidarity with you, hoping that next year at this time, there will be many more options and supports available for drug users and lives saved. I now want to introduce Joe Amaro, who is the supervisor of SHOPS, which is the Seaton House Overdose Prevention Site, to say a few words.
I'm Joe Amaro, supervisor at the OPS here, but more importantly, I'm a survivor of multiple overdoses. And I just want to say thank you for the beautiful weather we got, the nourishing food we got, the music, the inspiration. I want to thank all of the wonderful harm reduction initiatives that are here today. Thank you for showing up today, and thank you for showing up every day. I want to thank Monica Waldman for making SHOPS a reality, the Seaton House team. I want to thank my harm reduction coordinators and all the workers and all the OPSs everywhere for all the work they do every day. Because as we keep fighting for safe supply and decriminalization and everything else, we're going to need to win this. We have state supervised injection sites, and they're working. You know, when someone loses someone they love, that's a tragedy. When we all lose someone we love, that's a catastrophe. And what's happening here is nothing short of catastrophic. What can you say? I want to thank everybody that we lost. I want to tell them we love you, we miss you every day, forever. And you know, this catastrophe keeps getting worse, but together we keep getting better. And it doesn't seem to be going anywhere anytime soon, and neither are we. So give yourself a hand. And just thank you, and all my gratitude, and thank you. And let's enjoy our time together.
Okay, I think that is it for now. We will try calling them back later to give a few words. And in the meantime, enjoy the food and talk to each other and connect, and let's make the most of today. Thank you.
Don't forget to like, comment, share, and subscribe to our YouTube channel, and check out all of our social media platforms. For more information, check out our website.